Good morning, ma'am. Good morning, sir. My name is JOLE and Manlulu from BSN 11H, and today I'm going to perform the oral medication administration. So the significance of this procedure is that we can provide the correct medicine to the client and how we should prepare it before giving it to them. First thing we need to do is to know the reason why the client is receiving the medication. So there are a lot of instances that a specific client may be suffering from a certain disease or illness, and that would result to the different medications that we should provide to them for a specific client. The reason why we are providing medication to the client today is that he is experiencing dry cough for a week already. And now we must check for the medication administration record and check for the drug name, the dosage, the frequency, the route of administration, and the expiration date for administering medication. As for my client, the medicine that we are going to use is the Plemex Lagundi, and the dosage that we are going to give to him is as 5 ml or 1 tablespoon. For the frequency, we are going to provide this medicine 3 to 5 times a day. And then route administration is for PO or for RM. And the expiration date of the medicine would be on January 2023. Now, we must report for any discrepancies to the charge nurse or the primary care provider, as agency policy indicates. Now, we must verify if the client can take the medicines orally and determine if he can swallow, nauseated, vomiting, or is he having difficulty in taking the medicine. Now we must organize the supplies needed and gather the specific bar for the specific client that we are going to entertain today. And after that, we must perform hand hygiene with the use of alcohol, especially with this. And we must arrange and organize the medicine tray and medicine cups in the preparation area along with the medication tickets. So I have with me the medication tray, medication cup, and the ticket as well. Now we are going to prepare the medication for one patient at a time and obtain the correct drug, compare the name of medication on label with EMR or medication tickets, and exit automated dispensing system after removing the drug. Now that our materials are already set and already arranged, we must now perform the preparation for solid oral medication. And the first thing we're going to do is to read the medication label and compare it with EMR, then scan the barcode of the drug. So our medicine, for the solid medicine that we're going to use today would be the mefenamic acid. And we are going to scan it for the EMR. Okay. Now we must place the package unit, those capsules or tablets directly to the medicine cup. And note that we must not remove the medicine from its package until at the bedside of the client. So place this medicine here. Okay. We must also note that we must keep the narcotics and the medications that require specific assessment away from the others in order to avoid mess or complications as we are going to give the medication to the client. Break only scored tablets if it is necessary, and ask the pharmacy to split or cut the medicine, or if the nurse can do it, he or she must use a splitting or a cutting device, and check the agency on how they should use the unused portions of the medications that are ought to be discarded. And if the patient may somehow find himself or herself a difficulty in swallowing the medication, check if the medicine can be crushed, and if it is necessary, we must crush it for the patient. When preparing granuled or crushed medicine, we must follow the direction that is indicated by the manufacturer. Then we must obtain the drug and compare it with the EMR and scan the barcode of the drug. And then we must prepare the required amount of water and then mix it at the bedside. Now that we are done for the preparation for the solid oral medication, we must now proceed to the preparation for the liquid oral medication. So the first thing that we are going to do is to read the label of the medication or the medicine and compare it with the EMR and then scan the barcode of the drug. As you can see, we're going to scan the barcode for the EMR. And then after that, we're going to thoroughly mix or shake gently the bottle and observe if there are any color changes or any cloudiness. And if such are present in the medicine, that is an indication that the medicine is not in good condition or it is already expired. Then after that, we are going to remove the cap. Now, we are going to use our dominant hand to hold the bottle, and then our non-dominant hand to use or to hold the medicine cup. And after that, at eye level, we must pour the desired amount into the medicine cup. The reason why we are going to place it or position it in an eye level is for us to obtain a correct measurement that we are going to use. After using the bottle, we must wipe the lid using a paper towel in order to remove the excess or the remaining liquid that is surrounding from the lid. And after wiping it, we must discard the paper towel properly in order to avoid mess and to avoid contamination of bacteria as well. Then after that, we must prepare the liquid medication in oral syringe or dropper if appropriate and label the syringe properly or accordingly. So here's our syringe, and this would be our liquid medicine. For the final preparation for all oral medication, we must first check the label of the medicine before returning it to its box. So this will be the medicine that we used earlier, and this is its correct box. And then now that we are done with this, we must compare the client's name and the prepared drugs with the EMR in order for us to administer the correct medicine to the correct or the exact client. Now, we must ensure all the medicine cups and syringes are labeled and prepared accordingly in the medication tray, and do not leave the medication or the medicines unattended. So, this is the prepared medicine with the drugs along it. Also, we must lock the medication cart before entering the patient's room and make sure to check the room number against the EMR if the agency does not allow, or in case the agency does not allow the MAR machine to be removed from the cart. And if using the medicine tickets, we must bring the medicine tray with medicines and the tickets in the client's room. Now for the drug administration recording, I must introduce myself and verify the client's identity using the agency protocol and explain to the client on what procedure that is going to be done today. So, good evening, sir. My name is JOLE Manlulu from BSN 11H, your student nurse for today. May I know your name, sir?
My name is Iane Manlulu.
Okay, Mr. Leoj. May I know your birthday, sir?
October 13, 1996.
Okay. Is it okay, sir, if I look at your wristband? One way of knowing or verifying the client's identity, or one of the best things to do in verifying the client's identity, is to look at the patient's wristband. And karong day, sir, kanang paimnan di kag dambal karon naning orasa kay tungod para sa muhang ubo. Okay. Then after that, I must provide privacy to the client. And one way of doing so is always lock the door before and after going into the room of the client. And if he is in a ward setting, we must close the curtains in order to protect his integrity. Then, Educate the client and client's family of the medication to be taken, its purpose, route of administration, and possible side effects. Sir, kanang makatulon ba tambal karon sir no? Dili makamaludon, di ka kasukaon. Dili? Ah, okay sir. Tapos, ano sir, karong gabi kay Pemnan di kag lagundi na ano, na tambal or ato ang ginaingon na Plemex Forte. Para ni siya ay among ato ang route of ano ron or sa ato pag-inom is pinaoral lang, ato lang yan sa baba. Then, ang purpose ani kay para dili mag-irritate ng mga throat, para ma-smooth imong ano ba, dili na kaubuhon no taman-taman pag matumar ka ani.
Sige.
Ug wala ni siya possible side effects sir. Okay?
Dili siya drowsy.
Dili siya makadrosis sir.
Sige.
Next, we must perform the administration assessment or taking in the blood pressure, pulse rate, or respiratory rate of the client in order to make sure that he is in a stable condition and not stressed. So sir, kung hindi kag pulso sir, okay lang sir? As I took the client's pulse rate in a 1 full minute, the result of that was 76 pulse rate per minute. And it seems to be normal and the client is not in distress. And then next, I must now assist the client to a sitting position or a side-lying position. Questioning the client on what position he wants to makes him feel more comfortable during this procedure. So sir, kanang makaya niyo maligkod ta sir? Okay.
Kila.
Okay lang? Ah, sige.
Sige man.
We must now assist the client to sit down in order for him to be comfortable while taking in the medicine. And then the next thing that we are going to do is to compare the names of the medication on labels with medication tickets at the bedside. And if using EMR, scan the client's barcode to verify the administration of medication and pick up the due medication and compare the labels with the barcode. So sir, pwede na ko itanong mo rin ba sab sir? Kaya ako ang i-scan sir, kung sa dyan na ni mo ron. Okay.
Di ako scanner eh.
Lagi sir, high-tech na may diri ron sir.
Usa. Asa mo ka na ni? Unit up na no. Dirking.
Okay, sir. Now we have verified the client's medicine or the medication for this time. I'm going to pick up the medicine from the nurse station and come back to prepare and verify those kinds of medicine in order to provide it to the client now. So, sir, balik na ko sir ako. Ano na ito mga tambal, sir?
Sige.
Administer the medication at the proper time or the correct time and following the proper route and the agency guidelines. And also, prepare the medication at the bedside. So, sir, kanina mo tambal, sir, kay minom dapat ka ani 4 times a day, tapos once every 5 hours. So, nagsuhod ka gani alas 5, tapos 5, nya 10, alas 3, ug alas 8. Alas 8 naman ta karon sir. Mag-inom dani sir ha.
Gusto mo ito eh.
And after that, we must give the client sufficient water or juice. But before giving the client juice, we must check first if there are any incompatibilities between the juice and the medication itself. it may affect, because there are some liquids that we intake while drinking or taking medicine may somehow affect the structure and the purpose of the medicine. And then, sir, oh. Wait lang, sir, ha. Tubig, sir. Pang tulak, sir. Sir mo lang ba? In case of blood on. Okay lang, sir? Okay lang?
Kilang.
While the client is taking his medicine, we must also stay at the bedside in order to observe if he ingested the medicine properly. Now that the medication is already given at the correct time, we must now assist the client in a comfortable position in order for him to avoid the feeling of uneasiness. So sir, balik tagig da, sir. Okay, para makapuli ulit ang sayo.
Sige, maya na. Kapoy tayo. Sige,
Sir.
kasakit ba eh.
Sige, sir.
Ano sa discharge ako doon?
Ay, depende lang na, sir, sa doctor, sir, kung when, ibasig na pa siya ipapollow up sa mo na, anong check up.
Sige.
Wala yung contact si doctor.
Sige.
And after that, ensure that all medications are given at the correct time to the correct client, to the correct route. Then we must return the tickets that we used earlier to the nurse's ward in order to inform the other nurse that the medication is already given. And then ensure that the place is clean and organize the supplies on the medication tray. The reason why we are doing this is in order for us to maintain organized and somehow avoid possible mess and complications. Now that the bedside table of the client is arranged and fixed, we must now wash the equipment that was used earlier, such as the medication cup and the medication tray, and dispose the single-use items such as the gloves. After we remove the gloves, we must perform hand hygiene in order to deter the spread of microorganisms with the use of alcohol or sanitizers. After that, we are going to document each medication given to the client, and if medication is omitted or refused, we must also record this fact at the proper record and its reason as well, in order for the doctor and the assigned nurses to be alerted on what's going on at the situation around the moment.